artificial intelligence, as you might know, have been increasingly used in almost all the fields of medicine. And however, AI applications in medicine provide advantages to the current healthcare system, that's without any doubt. But there are also some associated challenges regarding, for example, the data privacy, the accountability, the equity, and the fairness. And of course, these challenges might hinder the medical AI implementation and also the widespread of this potential powerful tool. And in this context, I believe that ensuring trust and acceptance towards the technologies, it's crucial for their implementation and for the timely adoption worldwide. And so it's not my opinion, but it's really the product of different surveys, questionnaires that have been conducted in the past years, in which some key factors have been identified, key factors that could be really fostering and also supporting the application of AI in the future. And for example, I think that the first and foremost, most important one is the transparency and explainability. Because as you know, ensuring that the AI algorithms and the system are transparent in their operations and decisions, it's crucial, because this can provide an explanation, right, for the recommendations or the decisions that the AI is making in that moment. And of course, for any user, this is absolutely crucial, because this is also enabling the healthcare professionals to understand how AI arrives at such a decision, and also to contribute to a final step towards the final decision. So I think that this would be absolutely, and with no doubt, the priority number one if we want to foster trust and acceptance in AI for the future. And the other major point, I would say that whoever wants to develop AI that is applicable to medicine needs to provide also robust data privacy measures. And this means that we need to implement something that it's like a stringent data privacy measure that allows to protect the patient data and confidentiality, right? Because this is a hot topic in the field of medicine in general in the past years. And of course, so if we want to develop something that is applicable and really trustable and acceptable for the medical application, we need to adhere to the established regulation. For example, in Europe, we have the GDPR regulation, the General Data Protection Regulation. And we also we need to be able to clearly communicate to patients how their data will be used. This is also very critical. And also the steps that are taken to protect their privacy and their data. So in my opinion, and also as a product of the scientific studies conducted in the past years, I believe that these are the two major factors for fostering trust and acceptance. However, I believe that there are some other factors that are really crucial as well. And for example, the accountability, right? So the accountability and the oversight of the AI application. And when we talk about accountability, we need to talk about establishing in a proper way clear lines of responsibility, right, for AI systems within the healthcare institutions. So this means that you need to define roles and liabilities for the healthcare professionals and the AI developers regarding the use, the monitoring, and the evaluation of the AI application. Also, equity and fairness, of course, this also needs to be addressed because addressing biases and disparities in AI algorithms, it's crucial to ensure that these are equitable healthcare outcomes. Right, so this is also absolutely key, and by that you can also prioritize the fairness and inclusivity. Then there is of course, the collaborative approach that I think it's the basis of having AI applications that are valuable, of a valuable application. And so this means putting together all the stakeholders in the field, like healthcare professionals, patients, regulatory bodies, and AI developers, of course, all together for really creating and developing and validating AI applications that ensure alignment since the beginning. So that we really do not encounter any roadblock at the end of the implementation of such AI application.